Thank you very much. Well, representing a civil society organization, I'm going to be speaking on behalf of my organization, but there are other organizations in the audience that hopefully at question time, if you have experience and information you want to share, we can share the floor. So in terms of Action Against Hunger, we're really excited about the 2013 Lancet series because we've been working, committed quite to ending child hunger in several forms, actually working directly on child malnutrition and also the underlying causes. And we're super excited because you spoke about the care practices for the first time. Not for the first time, but more prominently in this series than the first one. And we're really excited about that. And we were also kind of interested in the coverage side of things, and we've already started asking questions this morning about monitoring and evaluating coverage of nutrition programs. And also you mentioned nutrition in emergencies in the 2013 series, which we're also very excited about. Most of our experience has started in nutrition in emergencies, and so we're also quite interested in that. And the linkage between nutrition in emergencies and nutrition in development, which sometimes feels like we're talking to two different audiences. Okay. So we're very interested in the new framework. We thank you for that, mainly from the point of view of the different childcare practices. And in terms of nutrition in emergencies, especially where breastfeeding and how mental health and care practices impact on breastfeeding practices during emergencies, that's something that's very important to us in terms of programming in nutrition. The new figures on child deaths from undernutrition are very useful for advocacy. In fact, in terms of advocacy, the Lancet series 2008 and this one, I think, will be absolutely crucial in talking to different people, getting funding for various projects that sometimes we struggle to get funding for so far. For instance, breastfeeding, baby feeding tents in emergencies, that is very important. The focus on both the treatment of severe acute malnutrition and the prevention of other forms of undernutrition is phenomenal, and that is a word that was something we used constantly because I think at the last series somehow the treatment of severe acute malnutrition or acute malnutrition generally was sidelined, or it felt like it was to some people, but I think bringing the two things together and macronutrient deficiencies is very important from our point of view as ACF at any rate. And of course the coverage issue and also highlighting their delivery platforms was something that we're very interested in because we're leading in a consortia of different NGOs, civil society organizations, on monitoring exactly that, coverage and monitoring of nutrition programs, particularly the CMAM program, or at least the treatment of severe acute malnutrition in the community. So in terms of the series itself, I mean, we noticed that the severe acute malnutrition hasn't really changed between the 2008 series and so far. So something is not happening that should be happening where the treatment of severe acute malnutrition is concerned compared to wasting, which is declining slowly, but at least it is declining. Noting that wasting also accounts for 12%, 12.6, almost 13% of attributable child death is something that also we're very interested in, considering the numbers of children affected. I mean, it's 52 million children, whilst stunting is 165 million children, and it's 14% more or less. So it's still a very high cause of concern. So the key message to us that was very important from ACS perspective was this. For us, it's one key message that the preventive efforts should continue to focus on the 1,000 days, and the therapeutic efforts continue to target severe wasting. I think the two go together. They cannot be separated. You cannot have one without the other. So coverage and practice. From our point of view, coverage, especially for the treatment of severe acute malnutrition, will rely on two main things. the expansion of community services, as well as strengthening health systems. Now, in terms of the coverage, the 90% caused a lot of discussion internally. Is that a feasible target for us to reach? We're having problems in some programs reaching 50%. How are we going to reach 90%? And I believe one of the World Bank reports was saying getting from 70% to 90% would be the most difficult and the most expensive. So how are we actually going to do it? So that was a question of whether at the field level, when you come to somebody to say, well, actually, your coverage is 50% and you need to be at 90%, it could be a little bit demotivating. Or if you're at 30% and you think, I need to get to 90%, how do you physically and practically do that? And there's some issues in terms of reaching that coverage that we discussed. Community-based services depend on community health workers. Now, funding for community health workers is very difficult. If you know, the traditional model for most of these programs is that donors tend to pay for materials, and the governments will pay for human resources and the delivery. So expanding and actually paying community health workers is quite a big challenge, especially for the poorest countries. And sometimes we cannot get that coverage simply because we don't have the community health workers to be in the community. So in terms of expanding or scaling up nutrition, we really need to kind of think about this aspect of the human resource package. In terms of quality as well, that's pretty key. When you're scaling up to 90%, how do you maintain quality? How are you going to do that in a practical term? This implies some kind of supervision and support for the community health workers if you're going to go down that route. Now, from our point of view, and that's not such a great slide, but at least just to show you, the Coverage and Monitoring Network is the consortium of civil society organizations who've been working on exactly that, coverage and monitoring what are the difficulties of scaling up in some of our programs. And the coverage rates vary from Senegal, 17%, to the best one is 79% in Ethiopia, in Dolo Ado. But these are not national coverage rates, they're regional, most of them. So to get a coverage rate of 90% is not going to be very easy. So it varies in between 17% and 79%. And the coverage monitoring expert is sitting back there. So if there are any questions about that, I'll defer them to him. So the health sector is the delivery platform for some of these nutrition-specific interventions. And when you actually follow up on where the money is going in terms of ODA for nutrition at any rate, about 50% is going to the health sector and 50% is going to the humanitarian sector. So the health sector is actually the front line for delivery for most of these programs, the proven direct nutrition interventions or nutrition-specific interventions. So strengthening those systems is going to be pretty much a key aspect. And in order to increase access to health services and create that enabling environment. Now, the costing of the interventions. We are now talking about 10 proven interventions, 90% coverage, $9.6 billion. Now, we've been mapping ACF funding for direct nutrition interventions based on the 2008 direct nutrition interventions to see exactly where we are. So I think 9.6 billion is not a lot of money, really, if you think about some of them, what we spend on other things. But if you look at where we are as of 2011, these are estimates. In 2011, we're spending about $222 million, I think, or just about 0.3% of total ODA on direct nutrition interventions, based on the 13 costed interventions by the World Bank. So we are quite far away from where we want to be. It's a long road, and I think somebody said we need to get. I'm not putting this out to be, depressing, but really just to show that we've got a long way to go and we need to put our track shoes on rather than high heels, for instance. It's going to be a long road. So in conclusion, I'd really like to say we welcome the 2013 series on undernutrition. Congratulations to the authors, and thank you very much. Some of the remarks and clarifications we had have been discussed in the morning. The 10 versus the 13, what you had last year, or 2008. There was a lamentation of a lack of WASH or a proper treatment of WASH, but then I think that was covered in terms of there was another, what was it? Series on water and sanitation. So that's been answered. And why countries such as DRC, somebody said brownie points for someone who spotted that. I spotted it. There are other countries that we questioned why they were not on the map. Somalia, CAR, Sierra Leone. And is it feasible to replace underweight as the main anthropometric indicator for children with stunting? Again, this was really based on the practicality of it, the retraining of people like community health workers, the paperwork that needs to accompany that. It's not going to be easy. I mean, when we do surveys, it's not that easy to do it in the community. So how are we going to do it? And do the authors still think that that's something that can be done? And how long will it take us? It's going to take quite a while. So we also wanted to clarify moderate acute malnutrition. We mentioned it, we included it in the attributable deaths, but there wasn't an intervention to directly target this problem in the 10 interventions. But I think that's also been answered because it was the lack of evidence and impact of moderate acute malnutrition programs at the moment. But if there's more along that thinking, we'd like to hear from the authors about that. So thank you very much.
Thank you very much, Sandra. Let me move on to our next speaker who doesn't have slides. Is that right? Yes. So I'm really delighted to introduce Anna Taylor, who's the Senior Nutrition Advisor from UK's DFID. I was talking about political leadership a few moments ago. I've watched in the last 3 years the United Kingdom government, whatever one says about the United Kingdom government in other domains, and I won't start now, in terms of international development, this government, and DFID in particular, has really shown stunning leadership. A couple of years ago, leading a fantastically successful Gavi replenishment round. Last year, launching a much-needed initiative around family planning 2020, which is being integrated into Every Woman, Every Child. And now we have the opportunity to see DFID and the UK government with other partners leading on nutrition for growth. So please give a warm welcome to Anna Taylor.
Thank you very much. It's really great to be here, really nice to see everybody. And I wanted to say a very big congratulations to the team, Bob and Lancet for the series. It's fantastic and really great. I know a huge amount of effort has gone into getting it this far, so very many congratulations to you all. So I wanted to do 3 things. I wanted to start by just reflecting a little bit on the journey we've come since the last series. And then I wanted to just tell you a little bit about what DFID's been doing in the meantime, in that period. And then go on to talk a little bit finally about what the challenges and opportunities are ahead. So to start with, in terms of where we've come from since 2008, I think 2008 was very important for 2 reasons. One, I think we had the political push, which was created by the food price crisis and created an opportunity at the political level for nutrition to elevate as an important issue. And at the same time, we had the pull which happened from the evidence. So we had the Lancet series launched, and we were equipped with a kind of common currency for talking about the problem, a common set of statistics, and a common narrative, which I think was a very good kind of confluence of two things. But I think we also had a couple of other things that helped along the way. We had an environment, I think, in the nutrition policy arena, represented by many of you, but many more too, where there was a willingness to really try and work together and to try and move beyond some of the fragmentation and that had been happening within the nutrition community up until that point, and a real desire to coalesce around the problem and the challenge and work towards some common solutions. So I think that was very important, and I think also starting to see some of the evidence emerging from countries which are successfully tackling undernutrition and the rates of reduction that they were achieving, countries like Brazil, which were of course fuel to the arguments. So I think that was very important in 2008, but I think what's happened since then are a few things. One, I think we've had multiple leaders. I mean, going back to Richard's challenge about who is the one leader, I think in fact we've had many political leaders who've stood up and said nutrition is important and needs to be tackled, and many countries represented through the Sun movement who've done the same. And I think we've got actually a kind of multiplicity of leadership, which I think is quite a unique characteristic of the scaling up nutrition effort which is going on at the moment. I think, secondly, we've now got this common language, and I think the Lancet, we've got a huge amount to thank the Lancet series for the first one, for that, and particularly driving the focus on the first 1,000 days. But we've also got this very helpful language around nutrition-specific and nutrition-sensitive interventions, which I think really brought everybody together, because suddenly we didn't have the people who are more interested in food-based solutions. They were covered by nutrition-sensitive people who were more concerned with behaviour change, those more concerned with micronutrient supplementation. It was a big tent. Everybody's specific areas had a role and a complementary part to play, and I think that language has really helped to bring us all together. And obviously the fact that that's now used in this series is, I think, a real endorsement of that, and will help to continue to build that sort of policy consensus that we've now got. I think the other thing which has been a big step forward when we go back to the last paper of the last series, whereas we've referred to several times the architecture was described as dysfunctional, we've now got a coordinating system. We've gone a huge distance really in the last few years to have much greater alignment at the international level behind country plans, and obviously much of that is captured through the Sun movement. So, and I think the groundwork that's happened through that process of building trust, building a common language, putting in place the building blocks for scaling up, putting on the table the challenges around financing, all of that has been incredibly helpful to get us, I think, to this point now where, as I think the challenge was put down by Bob at the start, that we've come a long way, but we've really got to start seeing the results now and the reductions in undernutrition. So the coalition government published its position paper in 2011, and that followed quite quickly after the previous government had published the first DFID nutrition strategy, which was in 2010. And that really, both of those papers really set the course for DFID's sort of engagement on nutrition. We've done quite a lot to try and, well, first of all, we've done quite a lot to try and skill ourselves up internally. We've had a course for staff. We've had 100 staff who've actually completed a course which was facilitated by the London School of Hygiene and Tropical Medicine on nutrition programming, essentially, and it's got a whole set of modules around nutrition sensitive programming as well as specific, and it's really helped to galvanise. Our system is organised around professional cadres. We have the health cadre, the livelihoods cadre, and others, and they've all been involved in trying to think about nutrition in the context of the sorts of investments which DFID is making in those different sectors. I think that's really helped to help progress the thinking around programme investments. And then we've had a really significant increase in the number of nutrition programs which we're now supporting, both nutrition specific and nutrition sensitive, and a whole mix of different approaches, specific to context and financing environments and so forth. And we've committed by 2015 to reach 20 million children and pregnant women, children under 5 and pregnant women through our nutrition programs, and that target's on track. So there's been a lot of effort going on in terms of what we're doing on the ground, but also wanted to flag up that we've really tried to grab hold of the agriculture nutrition research agenda, specifically to try and progress some of these critical evidence gaps that we've got and which are flagged up in the current series. Everything from kind of basic research around biofortification to more the sort of program evaluation and RCT type investments. So the whole spectrum of agriculture and nutrition is an area of the research agenda that we've really tried to address some of the critical gaps and prioritise in our research programme. And then the other thing that we've tried to do is to support the political momentum that's been going on that's been building really over the last few years. And the Prime Minister, David Cameron, hosted an event on the last day of the London Olympics here in London to try and really put into the headlines the problem of stunting and to try and secure a number of political commitments to tackle it. And then obviously in 2 days' time, under the banner of the UK presidency of the G8, we'll be co-hosting an event with the Children's Investment Fund Foundation and the Government of Brazil. This is the Nutrition for Growth event, which we're very excited about, and I think we're excited for a number of reasons. One is we think, given there's going to be a really fantastic group of people in the room, a large number of heads of state and ministers coming, as well as CEOs of companies, UN agency heads, CSO leaders, a whole range of critically important world leaders who are going to be talking about the challenge of undernutrition and, most importantly, making commitments about what they're going to do to tackle it. And so what we're hoping is that this will really kind of signal a step change in the level of international commitment and the country level commitment to tackle undernutrition, and that it will start to drive us towards a situation where we really build on what's been going on to date and start to see the reductions that we really need to see on the ground. Just moving on now to the future, I think I've got 3 challenges, 3 opportunities, and then 3 things I'd like to see in the Lancet series in 5 years' time, assuming there is one. My 3 challenges are, 1, architecture. So we've got the Sun movement, but it's got a timeline until September 2015, and I think we need to think seriously about how are we going to deal with the architecture long term. And I think particularly wanted to reinforce Sandra's point about the challenge of humanitarian and development, and we've got this quite divided set of structures, and they're very obvious in countries which are affected by emergencies, where you have the nutrition cluster and the Sun focal point, and not necessarily an integrated system of looking at the problem. I think the other challenge that we've got is around really trying to get a stronger public mobilisation around the problem. We're not in a similar place to HIV in that respect. We need to have a much more sort of public discourse. I think, Zulfi, you were referring to this earlier. There's a galvanising of civil society interest and concern about this problem. And then the third challenge I think we've got is the evidence still, as this series has underscored. We've come a long way, but we've got a long distance to go to really understand what are the right mix of programmes and policy solutions to tackle undernutrition in a rapid way. 3 opportunities. So I think the post-MDG, the high-level panel report, I think is a real opportunity. We've got a goal around food security and nutrition. It's a big opportunity that we need to grab hold of going forward. Secondly, I think there's a lot of discussion going on around the food system at the moment, and particularly with respect to sustainability challenges. But I think there's a real opportunity there to integrate nutrition and health into the challenge of the food system and how we make the food system more nutrition friendly. And then finally, I think the other opportunity, sort of from an international perspective, is the potential to link over and under nutrition discussions. And this series, I think, has really helped with that. And I think, from a DFID perspective, when we're making investments in, say, a country like Zambia, we've got to be much more specific about, much clearer about how we are really tackling this poor nutrition in its entirety, and with a focus on the early years. And then, so finally, 3 things that I'd like to see in the next series. Bob, I'm not sure if you're going to be taking that forward. So one is, of course, reductions in undernutrition. We really need to start seeing the World Health Assembly target to be on track. This will be 2018, so we'll have 5 years of increased investment, we hope, in place, and we should be in a situation where we're starting to see much faster reductions. Secondly, I think this challenge, and I'm guessing it must have come up a fair bit this morning, around the synergies between interventions. I think the challenge that we've got at the moment is we've got, with the way that we're researching the interventions is we're looking at them on their own, because of course we have to do that to a degree. But I think there's this big challenge about how does everything work together to deliver a greater result. And I think particularly with some of the interventions in paper 2, where even if you're doing them at scale, you're not necessarily solving the whole problem. So even if you're doing exclusive breastfeeding at 90%, promotion of exclusive breastfeeding at 90% coverage, you're not getting exclusive breastfeeding up to 90%. And I think this challenge about how we actually do multiple things to deliver those outcomes and how those things work together in a much more sophisticated way of trying to measure that. I think the metrics are really challenging, but we've got to try and grab hold of that challenge. And then I think finally, the third thing I'd like to see is more around what are the policy choices. So we're focused on the interventions, and obviously the last paper in the series really starts to move us towards thinking about governance and policy choices. But I hope that we'll be able to go further in looking at the countries that have been successful and what is that mix of interventions as well as policy choices and the sort of framing of the problem, which have been really important to deliver rapid reductions. So that's it from me. Thank you.